the anxiety, people spread rumors. Well, maybe you're going to quarantine New York City. We hear New York City is going to quarantine itself.
Tonight, 345 more people dead in Italy in the last 24 hours. The total now over 2,500. The health system buckling under the onslaught. Patients contained, although the virus is not. Families on lockdown. The dead are buried without them. Tonight, one glimmer of hope. Cases in Italy's original red zone down slightly. But back in America, concern over what's playing out in Italy. And they have more doctors and hospital beds per person than in the US. David, with America's top expert on infectious disease, Anthony Fauci.
Doctor, can you assure the American people that what they've witnessed in those images from Italy and from those hospitals won't happen here?
You know, David, I'm always trying to be as cold and honest. I don't want to scare anybody. There's no guarantee of anything.
Mounting in the U.S., now at least 100 dead, as the number of cases of coronavirus tops 5,800. And of course, authorities do believe that number is likely far higher given the testing in this country behind. And tonight, as so many families wonder where the next paycheck is coming from, how to pay for groceries for weeks, the White House now hoping to send families in this country a check. Tonight, President Trump proposing a massive relief plan, promising to, quote, go big against the invisible enemy with $1 trillion aid package for the airlines, businesses, and there is word the administration wants to send those checks to American families. The amount...
Tough new restrictions have come into force in France. No one can now leave home without a government form that they print out to justify their reason for being outside. For the next 2 weeks, people are only allowed out to go to work, to buy essential food or medical supplies, for a family emergency, or to exercise or walk a dog, but they must be on their own, and they face a fine if these conditions are not met.
Tonight, coronavirus driving Europe into crisis, with checks at national borders. Its unity tested in ways not seen since the last century. Most travel into the continent now banned, while the French are fined if they go out without good reason. A senior World Health Organization official telling NBC News today, America will soon see European-scale infections.
What we're seeing in Europe, in your view, is the future for America?
There will be parts of the US where I expect to see similarity to what's happening in Europe.
Well, we've been talking about the fact that people are staying away from towns and cities. This is the scene in Trafalgar Square. A bright spring day, normally full of tourists. As you can see, it is absolutely deserted. These are the streets of London at the moment.
In the eye of the storm, with too few hospital beds and more than 2,000 dead, NBC's Matt Bradley is in Rome.
Italy is still racing to catch up with its outbreak. This hospital building behind me, now just for coronavirus patients.
The British, rocked by a startling UK report warning of a catastrophic epidemic. The same research suggesting without any action, 2.2 million Americans could die. The UK's Prime Minister declaring a war with an invisible enemy.
We must act like any wartime government.
Tonight in communities big and small, this is the new normal as the coronavirus crisis changes daily life as we know it. New York City announcing it could soon follow the Bay Area's shelter-in-place directive. 7 million people told to go home and stay home. Cable cars here are idle. Snarled traffic over the Golden Gate Bridge is gone as the mayor works in an empty city hall.
What we have done is really what should be happening all over the country.
Now, how to sift accurate information from misinformation is becoming one of the challenges of this crisis, isn't it? And here's one example. We looked at Google Trends earlier. One of the top searches was ibuprofen, and that's connected to a statement from 2 days back where the French Health Ministry suggested that anti-inflammatory painkiller could worsen the effects of the coronavirus. The story has been very heavily shared. So in the UK has this WhatsApp message which says, from an NHS colleague, we've just been sent a medical alert that no one is to use anti-inflammatories.
City in Hubei province where coronavirus originated on January 23rd. And they've now started to see a slowdown. Compare that with Italy. They first reported a case, on January 31st, and they first did those lockdowns on February 21st. So a similar time period, except they only did a partial lockdown in the north of Italy. It was where I was for some time. We were back and forth to that part of northern Italy. They didn't shut down a wider area, that only came March 8th. There was a much larger lag, and that may be part of the reason why we're now seeing a much bigger issue in Italy than we have in China. Just to give you an idea, Italy now has reported to date 2,500 deaths versus China's 3,200 or so deaths. Now, obviously, Italy is a far, far smaller country than China, so its outcome is much, much worse. And we're now hearing, actually, if at this current rate of deaths in Italy, that Italy actually could surpass China in absolute fatalities. That is an extraordinary outcome.
Global death toll from this pandemic is now over 7,500, and there are more than 190,000 cases. I'm going to bring you up to date on the situation in a number of countries over the next few minutes. These are some of the most recent pictures to come in. This is from Barcelona, where people have been out on their balconies playing instruments, sometimes alongside each other. You can see a young guy there playing the saxophone. This is inside a rest home in Japan, where people have been exercising indoors because they're not allowed to go outside. And remember,
we have to. An extraordinary plea from Canada's Prime Minister to work together by staying home to help slow the spread of COVID-19. Good evening, and thank you for joining us. Across the country, tougher measures are coming into force as communities face the growing threat of the pandemic.
COVID-19 constitutes a danger of major proportions. We must act decisively. We must not delay.
May not return anytime soon. The governor of New York issued a dire warning that COVID-19 cases likely won't peak for at least 45 days, overwhelming the medical system.
They are expecting as many as 55,000 to 110,000 hospital beds will be needed.
As states called for a coordinated federal response, the president struck a more determined tone and walked back his earlier attempts to downplay the seriousness of the virus.
This is a pandemic. I felt it was a pandemic long before it was called a pandemic.
The White House is promising a massive economic recovery package, bailing out airlines, hotels, and businesses, and offering assistance to every person in the U.S.
We're looking at sending checks to Americans immediately.
Amidst the crisis, some states are pressing ahead with business as usual. Large states like Florida and Illinois pushed ahead with voting in the presidential primaries, fearing there may not be a better time to hold them.
The numbers, total people tested to date, we're up to 10,000 people, which is obviously exponentially higher than it was, and it's continuing to grow. Positive cases up to 1,300. New positive 432. Number of counties with cases continues to grow.
The crisis has not yet peaked in Italy, but in Lombardy, frontline healthcare is already on its knees. The laundry room of this hospital is being used to treat patients. Staff working 18-hour shifts, now treating their own colleagues too. A surgeon in Bergamo updated us on the desperate situation.
A progressively increasing number of nurses and doctors get sick and stay at home. Some of them are hospitalized too, and some of them are in the ICU too.
And what would you say to your colleagues in Europe?
To get prepared to shortage of things they would never think could get short of. For example, oxygen. And personal protection devices are stolen.
We've seen what it can do in Europe. We see that it's about 45 days away. And as a result, our economy is shutting down. It should shut down. That's the appropriate response. It's going to cause a lot of hardship. We need to deal with that hardship, but we also need to take all steps necessary to protect lives. Lives come before the economy.
We've been over this for about an hour now. It has been a constant stream of cars.
As long lines form at coronavirus testing sites across the country, it seems professional athletes are having no trouble getting their results. The Brooklyn Nets announced 4 players have tested positive for the virus, including superstar Kevin Durant, who recently signed a $164 million contract. The Nets say every player was tested after returning from San Francisco last week. ESPN reports the team used a private company and paid for the test out of pocket.
We're giving relief to affected industries and small businesses, and we're ensuring that we emerge from this challenge with the prosperous and growing economy, because that's what's going to happen. It's going to pop. One day we'll be standing possibly up here, we'll say, well, we won. And we're going to say that. Sure as you're sitting there, we're going to say that.